How did osteoporosis fracture classification evolve historically? Imagine trying to understand a puzzle that keeps changing shape. That's how the classification of osteoporotic fractures has evolved over time. At first, doctors simply looked at the shape of fractures and how they happened. They grouped fractures based on whether the bone was crushed, wedged, or bent. These early systems mainly focused on visible deformities seen on X-rays, like wedge or compression fractures of the spine. They also graded severity by how much the vertebral height was lost, often measuring in standard deviations from normal. But as imaging technology improved, especially with magnetic resonance imaging and computed tomography scans, doctors could see more details inside the bones. This allowed for more precise classifications that considered not just the shape but also the internal structure of the vertebrae. For example, they started to look at whether the fracture involved the end plates or the back wall of the vertebra, which are important for spinal stability. This was a big step because it helped doctors understand which fractures might cause more problems or requiring different treatments. One of the most significant advances was the development of the DGOU spine DGOU osteoporotic fracture classification system. This system groups fractures into 5 categories, from mild injuries with no visible deformity to severe fractures that cause major instability. It considers how much the vertebra is deformed and whether the posterior wall is involved, which can affect the risk of spinal cord injury or further collapse. This classification was created through collaboration among experts, combining knowledge from trauma and osteoporosis research. It's designed to be simple, comprehensive, and directly linked to treatment options. This evolution from basic shape descriptions to detailed, imaging-based systems reflects a broader understanding of how fragile bones are in osteoporosis. It helps clinicians decide whether a patient needs conservative treatment like bracing or medication, or if surgery is necessary. The goal is to improve patient outcomes by tailoring treatment to the specific fracture type and stability. Today, fracture classification systems continue to develop, aiming to incorporate more clinical factors and biomechanical insights. They support personalized care, helping doctors predict how fractures will heal and what interventions will be most effective. In summary, the way we classify osteoporotic fractures has grown from simple descriptions to sophisticated systems that combine imaging, stability, and clinical relevance. This progress makes managing osteoporosis-related fractures safer and more effective for patients everywhere. Always remember, if you or someone you know has a fracture, consulting a healthcare professional is essential for proper diagnosis and treatment.